today so the secretary can call the roll. I want to say that this is not any criticism of the way Senator Parker called the roll yesterday. I thought he did very good for it being his first time to do that. But Mr. Secretary, if you would call the roll.
Ryan,
Here.
Parker, Burnett, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingham, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins.
Thank you. We have 3 nominations today. They're for the State Board of Health and the State Board of Mental Health, which are 2 very important agencies. We appreciate these individuals coming to talk with us. As you know, they all have other things to do, but it's useful for us to have this chance to visit and have an interchange of ideas. The first item on the agenda is Senate nomination number 35, Elizabeth Edmondson. Ms. Edmondson, if you would just come up and visit with us and tell us a little bit about yourself and how things have been going since you've been on the board.
Do I start over? No. Okay. And so I thought, what a great opportunity. I have always been active in community service and been on board since, I guess, high school. So I went to college in Florida and got my degree in physical therapy there and have worked full-time and part-time ever since. I guess I joined the board last summer, was my first meeting, and everything has been by Zoom thus far. So.
Well, what's been your experience on the board so far, and how do you think things are going?
Well, I think things are going great. I think it's been super effective, even though we haven't met in person, to go over the varying points that we have to discuss. And I've enjoyed working with the other members on the board.
Apparently, very soon after you got on the board, the state health officer resigned. I'm not sure it was because you were on the board, but have y'all given thoughts about the search process for a new state health officer?
Yes. Well, I sure hope it wasn't because of me, of his resignation.
Well, there were people yesterday that said they hoped it wasn't because of them.
Right. I am not on the committee to help look for a new state officer. And so I do know that the board will work together to find the best person out to serve our state.
Thank you. Do other members of the committee have questions or comments? Senator Wiggins.
Hello, Ms. Edmondson.
Hi.
Good to see you. So thank you for your service and doing that. And I think when you live in Ocean Springs and you get appointed or nominated, you ought to come with an automatic confirmation. So question, and my question will be which is the same as yesterday with the other nominees and to the Board of Health. So it's been clear that not everything was done correctly during the pandemic. And so, and particularly between the policy and the political side. So what do you think, what can we do better going forward? Because there's probably going to be something else hit us. So that's my question.
I've joined at the near end of the pandemic. So I was not in it at the time when it first came out, but my time on the board since then has, in my opinion, has been super effective in working together with the other members and what policies have come through from to us to review and to, I guess, to, move forward on them. But to do better in the future, I think just open communication is key. I think between the political side and the state board, as much communication as possible is going to help move things more effectively.
Okay. And despite your reference from Secretary of State Watson, I think we will you look like a good nominee.
Okay, thank you. Any other questions?
Anyone else? If not, thank you for coming. We appreciate your being with us. We appreciate your being willing to serve. Is there a motion?
Advise and consent.
Motion to advise and consent. All in favor, aye.
Aye.
All opposed, no. Ayes have it. Thank you.
Thank you.
Dr. Waits, I believe you're next. If you'd be nice enough to tell us a little bit about yourself, and if you don't mind, why don't you tell us a bit about the Hattiesburg Clinic?
Oh, okay. I'm Thad Waits. I'm a cardiologist in Hattiesburg. I've been on the board for this will be my third re-up, and I'm presently chair of the Board of Health. My work in Hattiesburg is as a cardiologist. I've actually gotten to the age where I'm not on call or anything anymore, but I still am administrative and do some of the procedures. The Hattiesburg Clinic is now well over 300 physicians and well over 100 mid-levels or PPs. So we're with 400 and something providers in the city of Hattiesburg and in the surrounding area. The clinic is really keeping up with what's going on in the world of medicine and in the healthcare system regarding value-based care is something that we are a real specialist on. So the clinic is doing very well in conjunction with Forest General. You might want to know this, we now have an ambulatory surgery center for cardiac catheterization. There are 30-something states in the nation that have a certificate of need. We are the first state in the nation that approved ambulatory surgery centers for cardiac cath, and the clinic is the first clinic to have that. So we're leaders in the country. I'm in leadership on the American College of Cardiology and constantly am asked, how does Mississippi do these things? So I'm proud of that.
Thank you. Are there other members of the committee with questions? Dr. Barnett? I'm sorry, Senator Barnett. I've got doctors in my name.
Thank you, Senator, for that compliment. But I would just like to say on the behalf of the Hattiesburg Clinic, they have done some exceptionally great work in my area, and some of their clinics are in my district. And I just think that the work that they've done is a reflection of the people that are working for them. So without any other questions from this committee, Mr. Chairman, I would like to enter a motion at the proper time.
Sure. Dr. Waits, I know that the Hattiesburg Clinic has a number of satellite offices outside Hattiesburg. And one of the struggles that we have as a state is trying to get healthcare in rural areas. And I didn't know what your experience with that, with the clinics that y'all have, if you've learned anything that might be useful to us statewide.
We do have several outlying clinics, including in Wiggins, and well, I can't name them all. There's so many, including around the city of Hattiesburg. One of the main things we learned during the pandemic was telehealth, and both in the clinic as well as in my work with the College of Cardiology, we have really pushed the benefits of telehealth. And I think one of the good things the pandemic did was teach us that this was a valid way to treat patients. The patients in general liked it. The doctors in general liked it. Not everybody, but it is absolutely something to pursue statewide, nationwide, et cetera, to fully develop the ability to do telehealth medicine.
You mentioned Dr. Cheney, who was here yesterday with PNS Clinic, which is located in Amory, which is a town of 7,000 and has been there for a number of years. And it strikes me that one of the things that attracts people there is that the practice is large enough that you can have a day off, that there's somebody to cover for you, and you're not literally the only doctor in town. And I think about healthcare in rural areas, And it strikes me that one of the things that is a factor is actually having your own office, potentially without that support system. I have no solution for that, but I wonder if that's a consideration.
Absolutely. And of interest, Dr. Cheney is coming to the Hattiesburg Clinic in a week or so. I set it up for him, and he's going to look at how we're doing these things in the satellites. He alone is coming for a special visit with the clinic to learn some of the things that you're talking about right there.
Last doctor from Amory that went down there stayed.
I'm sorry.
The last doctor from Amory that went down to the Hattiesburg Clinic stayed.
Oh,
You make sure he comes back to Amory, you know.
okay.
Don't
Who
you-
was that?
Don't you keep him in Hattiesburg? My mind's gone blank. Senator Barnett has moved. We do advise and consent. Are you ready to vote? All in favor say aye. Opposed, no. The ayes have it. Thank you, Dr. Waits. We appreciate your being willing to serve. The third nominee that we have is for the State Board of Mental Health. Mr. Landrum, if you'd be nice enough to come visit with us and talk to us about what's going on at the Board of Mental Health and all the various issues y'all are dealing with.
Hello, thank you for this opportunity. I worked in the state junior college, community college system for 48 years prior to the time that I retired. And I lived in Ellisville for over 30 of those years so far, which brings me into the Department of Mental Health. My wife and I had a child that was mentally retarded, and he was diagnosed in the early 80s with that, and he was placed in Ellisville State School in 1984. And he lived there until he died in 2000. During that time, I also had the opportunity to serve as on the Parents Association at Ellisville State School. And in 94, I was appointed to the State Board of Mental Health by Governor Kirk Fordyce. And in 95, I'm at the legislative board and was approved to serve that. So I've been serving on the State Board of Mental Health since 95. My wife and I had we not lived in Ellisville, our child would have probably not been in Ellisville State School, and that would have been very difficult for us because of his care, the level of care that he needed. He had something called Felipo Syndrome, which is very rare. There was less than 10 known cases of that in the latter part of the 70s when we were carrying him to Tulane and Ochsner's, and he was one of the few cases in the south part of the state, and he continually went down in his ability to do things from the time that he was born. Like he knew the Pledge of Allegiance to the flag when he was 4 years old. When he was 6 years old, it just became the pledge. He couldn't remember the rest of it. He's like me, he loved food. So he did remember, he knew the alphabet, but a lot of what thing he could remember is P for pizza and M for McDonald's. He could remember those two things. And believe me, we spent a lot of time going back and forth to McDonald's because he loved McDonald's. But I've had the privilege of serving on the State Board of Mental Health since 95. That's 5 governors and 5 executive directors. And you notice I'm walking with a cane. I think that's part of it. They just wore me down probably during that time. But we've seen a lot of changes in mental health since then. A lot of our clients that were in institutions have gone out to the community and are living in the community now. And thankfully, we did not lose all the abilities to care for our clients inside of the institutions. They are clients that do need institutional care. And our child was one of them, I think, that needed institutional care. But now we also watched a lot of clients go out to the community in Ellisville as well as surrounding communities. And I think that's a good thing that they lived out in the community, many times near their home, sometimes just in group homes. My side of mental health is more toward IDD and mental retardation than it is in mental health, because that's where I grew up. That's been my lifetime endeavor, was to make sure that children like our child was provided for. So that's what we've worked in. But I appreciate this opportunity, and I'll be glad to try to answer some questions for you.
You said that you served during the tenures of 5 governors and 5 executive directors. Which was more difficult, the 5 governors or the 5 executive directors?
I'm sorry, which one?
Which was more difficult for you, the governors or the executive directors?
Yes, sir. You gonna put me on a real spot, aren't you?
So as you mentioned that you were close to Ellisville,
Yes, sir.
and that was convenient for your family. And I know you know that we're struggling with trying to get more community-based services, and I wondered if you had a perspective on all of that.
Yes, sir. We had parents, there were children at Ellisville State School, just like there are children in our other IDD centers from communities away from the site. Like I know that in Oxford, there are children there, but their parents live, in some cases, they actually live in the south part of the state. Ellisville State School, they lived up in Neshoba County. And so parents drove a long distance. I do not know why they were at Ellisville State School instead of some other center. That was just the center that they had an opening to place those kids. I know we are missing, due to us being the Department of Health, not being able to serve those people inside of an institution. We have a large number of people out there that their parents really need help to assist their children, and they can't take care of them at home. And an example of this is a lady called me that her husband had left her. They have a 21-year-old child that weighs 200 pounds. And she said, I cannot roll him over and change his diaper. And she said, I'm having great difficulty. What can we do? Department of Mental Health did help her some, but it wasn't the help that she wanted. She actually wanted him to be in Ellisville State School instead of at home and receiving care at home. She thought that he needed to be down there because she said, I just can't take care of him at home. I'm gonna lose my job now because I don't have any way to take care of him. So we do not have, up till now, we have not had crisis beds in IDD centers across our state. We do have them on the mental health side, but we don't have them on the IDD side. And in one of the new proposals that we heard the other day, there is some crisis beds now coming. So we could have taken care of this lady now. We couldn't take care of her then inside the center because we just did not have any beds available. So they are so many opportunities for us to serve the IDD population as well as mental health population. And we have a lot of folks out there that are combination. They are IDD people, and they're also mentally ill people. So up to now, we have not had crisis beds take care of them, and we do have that now. Or we will have it before long, and thankfully it came through funds that y'all provided.
Do other members have questions? Senator Parker?
I just want to say over the last, I guess, few days or so, we've had the opportunity to have a number of people come before us. And I've just been very impressed with the people who are going on your particular board. What I find in common in the people who are seeking to be on the Board of Mental Health is the personal experience. And as we look for solutions on that, I just want to let you know that I think you have, as somebody who's been there a number of years, you have some new assets to the board that I think you can put to work and draw on their personal experiences to try to move this forward. So just appreciate your willingness to serve for so many years. And at the appropriate time, I'd love to make a recommendation.
Senator Barnett.
Yes. Thank you, Senator. To this committee, I can say that I have had the pleasure of working with Mr. Landry. We've kidded each other over the years about his twin brother, and he knows who I'm talking about.
Don't be talking ugly now, sir.
But he has been, in my opinion, one of the most dedicated individuals working with those parents and those clients at Ellisville State School. Even after the passing of his son, that didn't diminish his passion to continue to help in every capacity that he has. And I'm just glad to see that he has been appointed again to serve on such board, knowing that we have someone there that genuinely cares about those others who can't, in other words, do for themselves. So thank you again, Dr. Landry, for what you have done, and welcome to this board again. Thank you.
Thank you, sir. I appreciate that.
Thank you, Mr. Landry. There's a motion. We do advise and consent. All in favor is aye. Opposed, no. Ayes have it. Thank you. I want to thank the three of you for being willing to serve. And I want to thank you for coming to the Capitol today to visit with us. These are two important boards that are going to have their hands full in the future. And thank you for being willing to assist. At this point, we will rise and report.